Hello, my name is Jeff Davis, Director of the Ohio Department of Developmental Disabilities. I am pleased to discuss DODD's State Fiscal Year 2020 and 2021 Strategic Plan and Priority Initiatives aimed at strengthening the developmental disabilities field in Ohio and making our department better. We have immense talent and resource throughout our developmental disabilities system, and our vision is to be an integrated system that helps and empowers people to live their best life. DODD's mission is to improve the quality of life for Ohioans with developmental disabilities and their families wherever they choose to live, work, and spend their day. The department's 7 core values are grounded in ensuring that we are focused on customer experience for the people and families we serve, and for our county boards, providers, and advocacy associations we partner with and who ultimately make the system work. 1. Kindness and empathy. All interactions will be based on genuine care and concern for all involved. We will listen to our customers and each other. 2. Collaboration. We will engage with one another and our partners with openness and trust. 3. Transparency. We will be accessible and visible in our business practices. 4. Innovation. Through technology and new ideas, we will simplify and make our system more efficient. 5. Quality. The services we deliver will be value added and promote excellence. 6. Inclusiveness. We will embrace diversity and ideas at every level of our interaction. 7. Accountability. We will conduct ourselves professionally and will manage taxpayer dollars responsibly. The structure of our objectives will address the following strategic goals. First and foremost, our customers, the people and families we serve. Our second goal addresses our partnerships, ensuring the effective delivery of services. Third, DODD's internal operations will aim to support system and service excellence. I would like to provide you with highlights of several key initiatives and programs that will directly promote enhanced service delivery at the local level. Related to the department's first goal to support the people and families we serve, there are 3 initiatives being rolled out. First initiative, the statewide individual service plan, or ISP, is one part of our overall approach to modernize service and sport administration. Currently in Ohio, there are many different templates used for assessments throughout all 88 counties. Plans can be complicated, hard to read, and they inhibit our ability to efficiently and effectively implement services for the more than 90,000 people with disabilities we serve in the state. By transitioning to a single ISP and assessment template to be used across the state, we will better serve people with disabilities by having a meaningful, person-centered plan and helping their providers easily navigate the plan to deliver the needed supports. That will ensure consistency, simplification, standardization, and portability. Transitioning to a single ISP is a significant development that requires collaboration and thoughtful implementation. As a result, the Ohio ISP Work Group was created in 2019 to develop and implement a common assessment, common plan template to be used for all people receiving developmental disabilities services in Ohio. Following feedback forums from multiple locations throughout the state, in May and June of 2019, the work group commenced its charge in July 2019. The group of 25 stakeholders included people receiving services, family members, waiver providers, employees from intermediate care facilities, and county boards of developmental disabilities. Work group members represent Ohio's geographic diversity with representatives from both urban and rural counties, as well as the providers who provide services in those regions. The Ohio ISP Work Group reviews feedback from previous work group meetings, which informs the development of the ISP and assessment templates and determines the course for piloting, training, and implementation. The work group meets monthly and will continue to do so throughout 2020 until its charge is completed. The pilot assessment template began in January 2020, and the work group will review data collected throughout the pilot to decide on necessary updates and changes that need to be made to the template and training. The second key initiative involves the Early Intervention Program, also called EI. EI is a statewide system that provides coordinated services to parents of eligible children under the age of 3 with developmental delays or disabilities. EI is grounded in the philosophy that young children learn best from familiar people in familiar settings. Every family served in EI will have a local EI team that consists of a service coordinator, service providers, and their family. County boards of DD provide over 95% of the services families receive in EI. A child's team works with the family in their home or at other places they spend time in order to develop a coordinated plan called an Individualized Family Service Plan, or IFSP. The team will work through the plan, building upon existing supports and resources while discovering ways to enhance the child's learning and development. In Ohio, a child who has an elevated blood lead level, or BLL, or a confirmed diagnosis of neonatal abstinence syndrome, or NAS, is automatically eligible for early intervention. And anyone can refer a child to EI, and any child with developmental concerns can be referred. You do not need the referral to come from a doctor. Referring is as simple as calling 1-800-755-GROW or 4769, or online at ohioearlyintervention.org. The third key initiative is supporting young people with intensive and complex needs, often referred to as multi-system youth. DODD successfully added budget language to allow intermediate care facilities to receive an additional rate on top of their base rate to serve youth who require intensive behavioral supports. Through specialized training for staff and environmental modifications, this option will provide another option for families who need this specialized type of service. In the spring of 2020, DODD will be soliciting ICFs through a statewide competitive review process to submit applications to provide this service for our multi-system youth and their families. Project ECHO, which stands for Extension of Community Health Outcomes, uses a trademarked technological platform and methodology to offer those participating in the ECHO session opportunities to present cases involving multi-system youth to a panel. The panel consists of a multidisciplinary team of experts who provide written recommendations to the team supporting the youth. Each ECHO session offers teams the opportunities to develop the knowledge and skills to manage complex conditions in their own communities and to be part of a community of practice, which includes brief lectures, case-based learning on topics of special interest, and free, convenient, continuing professional education. Related to the department's goal to effectively deliver services by supporting our partners, I'm going to cover the Homemaker Personal Care, or HPC, reimbursement rate increase, which is expected to improve the total compensation package of Ohio's direct support professionals, or DSPs. The largest increase in Ohio history for HPC reimbursement rates was introduced by Governor Mike DeWine. It was bolstered further by the Ohio legislature and a financial commitment from Ohio's county boards of developmental disabilities. Included in the budget is a $253 million investment to increase the reimbursement rate component for home and community-based services waiver providers who deliver homemaker personal care or on-site on-call services through the individual options, Level 1, self-empowered life funding waivers. This is a truly momentous investment, but we also know that there are questions about what this increase means to DSPs and providers. I want to be clear and transparent about how the rates are structured and how the department expects investments to be used. Providers are meant to use this reimbursement rate for DSP compensation. Like other businesses, there will be variations in wages providers pay, including how they structure their benefits, packages, paid time off, and other ways they support their employees. The department expects that DSPs will benefit from this increase, and DODD fully anticipates seeing that the total compensation of DSPs across our state will rise due to this investment. As part of this process and in collaboration with our system partners, the department will be establishing a reporting process to collect data from providers relating to total DSP compensation. The results of this process will be reported to the department and made public. Finally, related to our third goal that promotes our agency's operational excellence, I wanted to share with you what we are doing to increase efficiency and the use of technology. One of our priority informational technology initiatives continuing through 2020 is the County Board Data Exchange. This project is focused to allow data exchange between DODD systems and county boards of developmental disabilities. Through this initiative, DODD is solving the problems of duplicate data entry in multiple systems, increasing accuracy of data in our reporting systems, allowing caseworkers, service and support administrators, people with disabilities, guardians, and providers to access their data in a secure environment. DODD has also continued the statewide implementation of the Ohio Technology First initiative by working with people with disabilities, their families, service providers, and county boards of developmental disabilities to ensure supportive technology is considered as part of all service and support plans. DODD's target for 2020 is to get all 88 counties actively participating in leveraging remote support and assistive technology services. Continuing to lead with innovative practices around the use of technology, DODD, in partnership with the Ohio Center for Autism and Low Incidence, known as OCALI, is building and piloting a virtual reality training experience in 2020. The purpose of this virtual experience is to inspire and empower direct support professionals by strengthening their observational skills, knowledge, and empathy toward the people they serve. Further, it will help DSPs recognize that no matter what behavior a person with developmental disability exhibits, it serves as communication. I would personally like to thank you for your service to your county and for taking part in this training. I hope you found it useful, and I am excited to work with you to move Ohio's developmental disability system forward.